Now, the most common tumor of the bone is metastatic tumor or secondary tumor. So, all bone metastases are from carcinomas, مش من sarcomas. The primary site of carcinoma that commonly go to bone are orderly: breast, prostate, kidney, thyroid, lung, and RCC, and those tend to be osteolytic. يعني osteolytic, destructing the bone. While prostatic adenocarcinomas can be osteoblastic. They what? They initiate new bone formation. Okay? This is the histological appearance of metastatic carcinoma. Those are the bone trabeculae. طلعوا كيف شكلهم. بيفرقوا عن الاوستيويد اللي شفناه في الاوستيوساركوما. They are mature lamellated bone. And we have an infiltrative large epithelioid cells. Okay? This is metastatic ductal carcinoma of the breast and seen within the blood, filling the marrow cavity. There is reactive new bone with pale pink osteoid being laid down near to the bone spicule at the upper left. هاي هون شوية new الاوستيويد بس زي ما انتم شايفين it is ايش benign. طلعوا هون those are the malignant cells. Now the next tumor is a benign tumor. It is called osteochondroma of the bone or exostosis. Now exostosis, it is a protrusion from the bony surface. And it is called osteochondroma because it is composed of bone and cartilage. Okay? So most lesions or most osteochondromas are solitary. Incidental lesions that may be excised if they cause local pain. Yani they are totally benign. The excision or the indication for excision of exostosis is symptomatic problems such as pain or deformity. There is a rare condition of multiple osteochondromatosis marked by bone deformity and by greater propensity for development of chondrosarcoma. يعني الناس اللي بيكون عندهم multiple exostosis بيكون عندهم high risk of development of what? Of chondrosarcoma. مش osteosarcoma ولا Ewing sarcoma. Okay? This is a resected osteochondroma composed of this cartilaginous cap and a core composed of bone. So, a bluish-white cartilaginous cap overlies the bony cortex. Okay? These are probably not true new plant. تعالوا. وين فايتين؟ ايش؟ وين تفوت جوا؟ شو بدك تسوي؟ انتوا وين كنتوا؟ مش كان عندكم محاضرة؟ طيب وهذول كلهم كان عندهم محاضرة وكلهم وصلوا. ضيعت الله. These are probably not a true neoplasm, but a localized proliferation producing a mass lesion that extend outward from the metaphyseal region of the long bone. So this is يعني مش كثير 100% صحيح هذا الكلام انه they are not a tumor. They are فعلا a neoplastic growth, so they are a tumor. But what you all need to know that it is composed of cartilaginous cap, bony cortex, and this is the histological appearance. We have mature cartilaginous cap, and we have this osteoid or bony cortex inside. Okay? So this is the microscopic appearance of an osteochondroma. Displays the benign cartilaginous cap at the left and the bony cortex at the right. This bony growth, though benign, can sometimes cause problems of pain and irritation that lead to be removed surgically. This is what is called giant cell tumor of the bone. It is also benign tumor. It occurs here. We have this proximal femur, okay, has been amputated and cut in half to reveal an irregular dark red black hemorrhagic mass in the epiphyseal region. Remember, epiphyseal region. So giant cell tumor occurs where? In the epiphyseal region. In contrast to metaphyseal region for osteo and chondrosarcomas and diaphyseal region for Ewing sarcoma. So giant cell tumor appears lytic on brain film radiograph. This is the histological appearance of giant cell tumor. As you can see, we have large osteoclast-like multinucleated giant cells embedded into a mononuclear stromal cells. As you can see, the nuclei of the mononuclear cells are the same as those of the multinucleated giant cells. So giant cell tumor of bone seen here are composed of osteoclast-like multinucleated giant cells in a sea of round to oval mononuclear stromal cells. There may be also foamy macrophages and hemosiderin deposition in the stroma. Though these tumors are biologically benign, they can expand and cause pain, deformity, or fracture. So they are locally destructive or invasive, but do not have malignant potential. But they are treated by curettage or resection. But when radiated, they may undergo malignant transformation. curettage يعني بدون ما يقطعوا البون، يشيلوا البون، بدخلوا بشيلوا ايش؟ التيومر، شيء اسمه الكيوريت، كيوريت زي السكينه هيك، بشيلوا فيها التيومر من جوية البون، بس بخلوا البون ايش؟ انتاكت. ريسكشن ممكن يشيلوا البون اللي فيها التيومر زي الصورة هاي اللي احنا شايفينها. اوكي؟ The next lesion that could affect the bone is called the brown tumor of the bone, and this occurs in patients with hyperparathyroidism. Hyperparathyroidism. Now, in hyperparathyroidism, from its name, we have high parathormone level, which increases the osteoclast activity in the bone and produce irregular bone resorption with microfractures and hemorrhage and macrophage proliferation with fibrous connective tissue proliferation. تعرفوا انتوا الباراثايرويد هرمون شو بيعمل؟ increase blood calcium levels. How do it do that? Resorption. بيروح على البون بيعمل resorption للبون، الكالسيوم اللي بيطلع وين بيوديه؟ على البلد. فبالتالي شو بصير في البلد كالسيوم؟ بيرتفع. Okay? Now, if we have hyperparathyroidism, we will have exaggerated bone resorption. And this will result in microfractures, proliferation of fibrous connective tissue, and macrophages and giant cells. ليش اسمه براون تيومر؟ لأنه فيه هيموسيدرين كثير، بيكون فيه high amount of hemosiderin, which gives it its brown color. So the center of brown tumor, as we said, contains osteoclast and mononuclear cells, and fibroblasts with focal hemorrhage. The hemosiderin from the hemorrhage produce the grossly brown color. Such lesions are nowadays uncommon because hyperparathyroidism is treated before such lesion develop. يعني هو ايش؟ needs long standing hyperparathyroidism in order to ايش؟ to develop البراون tumor. ما بصير from only يعني مدة قصيرة من الايش؟ hyperparathyroidism. هلا هاي اخر شيء عندنا اللي هي الفايبرس ديسبليزيا. Fibrous dysplasia of the bone is a non-neoplastic process in which the bone there is localized area which have irregular woven bone. هاي irregular woven bone هيو شايفينه؟ This is an immature bone. شو يعني woven؟ woven يعني still not mature، لأنه الماتور شو بيكون؟ بيكون laminated. شو يعني laminated؟ يعني في ايش؟ زي الخطوط. Okay? This is ايش؟ laminated. But this is ايش؟ an irregular immature woven bone, which proliferates but does not develop into solid lamellar bone, leaving a weakened area that can produce deformity or fracture. Now, most cases of fibrous dysplasia are monostotic. شو يعني monostotic؟ يعني affecting one bone or one area of the skeleton. While we have also, زي ما حكينا, single area in adolescence, we have polyostotic forms which often appears earlier in childhood and persist later into adulthood. And some of them is associated with Makuni-Albright syndrome, which is composed of polyostotic fibrous dysplasia in conjunction with cafe au lait spots on the skin and disorder of endocrine system. In the low power view, we have this irregular woven bone in a dense fibrous stroma, and here we have a higher view for this lesion. Now, those bone trabeculae sometimes named as Chinese letters, سموهم as Chinese letters because they are irregular and branching, just looking like the Chinese letters. Okay? حدا عنده سؤال؟ استفسار؟ يعطيكم العافية.
نعم.